Good evening, everyone, and I am Dr. Rahul Pandit. You are watching the 420th non-stop edition of Dr. KK's MEDTalks show. Let's have the headlines for the day. India administered more than 1.13 crore vaccines in the last 24 hours. The total vaccination coverage now is nearly 70 crores. Himachal Pradesh is the first state in India to have administered at least one dose of COVID 19 vaccine to its entire eligible population. I think it's a very, very great achievement. India reported 31,222 daily COVID new cases and 290 deaths in the last 24 hours. Of these, Kerala contributed 19,688 cases and 135 deaths. Cuba has become the first country in the world to start administering COVID-19 vaccine to toddlers, which is children between 2 to 3 years of age. With vaccines developed in the country itself, although these vaccines have not been approved by the WHO, it becomes the first state to do so. Singapore Ministry of Health has said that Singapore needs to take quick action to reduce the increasing chances of an exponential rise in COVID-19 cases. The number of new COVID-19 cases in the community has almost doubled to more than 1,200 in the last week, up from 600 the week before. So that's for the headlines for the day. And along with me, we have Dr. Shashank Joshi, who would be joining us very, very shortly. Dr. Joshi is a Padma Shri Award winner and a renowned endocrinologist. And let's have the topic of the day today. So, Dr. Joshi would be joining us shortly, as I mentioned. He is the renowned endocrinologist, a Padma Award winner, and he has been very, very kind to allow us to do the show. He's just stuck a little bit today, but he should be joining shortly. And today we are discussing about, are we on the threshold of the third wave? Why has this topic actually come into the discussion altogether? Why are we even talking about this? The reason why we are talking about this is that we saw that we are having almost 30,000 plus cases every single day coming in our country, of which majority are contributed by two states. For number one is Kerala, the second one is Maharashtra. And what we are seeing in these two states is that Kerala distinctively had two different phases of its second wave. The first phase of the second wave was when it actually went through the entire country, where the whole second wave was going through the entire country, and Kerala had its share of numbers. The second phase came up just around Onam time, a week or two before Onam, and now it has continued, though we are seeing a slight plateauing and bettering of the cases in the last couple of days. But Kerala had the second peak just around Onam, where they almost doubled their cases from around 15,000 a day to 30,000 a day. What has been the important thing about Kerala is that Kerala is also the largest state in terms of the vaccination number. Of course, Himachal Pradesh is now taken over, but amongst the bigger states, Kerala is one of the states where maximum population had received at least one of the vaccine doses for COVID-19. And traditionally, in the whole pandemic, Kerala's mortality has been one of the lowest in the country. And we are seeing the same sort of a thing which is happening right now in Kerala. We are seeing that we have a less number of cases which are coming up into the hospital. So their hospital systems are not a burden despite the numbers going up, and the mortality is still remaining same. It is very, very low. Maharashtra, on the other hand, has got a thick tail, and the tail continues to be somewhere between 3,000 to 4,000 cases, though the trend has been on a declining trend for the last week or two. Some of the districts, precisely 4 or 5 districts, which is Mumbai, Thane, Ahmednagar, Satara, here the case rise has actually started to go up significantly. And that's what the worry is. For example, Mumbai has doubled its cases from 190, which was on 16th of August, to around 490, which is there now in the last couple of days. And the second problem is that the test positivity rate has closing towards 1.1% in Mumbai, which are the two things which actually tell us that are we on the threshold of the third wave. And I think that's what we need to be worried about, that is the start of the third wave going to happen from these two states and then spread it across the country. The other thing which worries us about the third wave is that we still haven't had significant amount of vaccine in terms of both doses given to our population. Now there are some encouraging signs in the last week or so. Every single day we are crossing the 1 crore mark almost consistently, which I think is a huge task, a mammoth task for the health community at large. I must congratulate the government of India and all the people and stakeholders which are actually trying to give their best to improve this vaccination as quickly as possible and as fast as possible achieve the concept of having maximum population covered under the vaccine umbrella. However, if that is going to take some time, it is in our hands now as responsible citizens to make sure that we give enough time for the government to complete the vaccination and not have the third wave called upon us because of our behavior. And what are those things which we can do? I think we have always talked on this show. Honorable KK sir has talked on this show all the time that first, wear a mask. Mask is the best vaccine right now which you have. It is effective against all strains. You don't have to worry about the strains. Second, take your vaccination. Whichever vaccine is being offered to you, please complete the doses as per the vaccine requirement. We all know that Covaxin, Covishield have got 2 doses, Sputnik has got 2 doses, the Zycovid, the Zydus Cadila vaccine has got 3 doses, which is yet to be launched. The Johnson & Johnson is going to be with 1 dose. So whatever dose, whatever vaccine you're taking, make sure that you complete the regime so that 15 days after that, you are going to have a good immune response for yourself. Third is, if you can avoid going to crowded places, please do so. Please do so. And I think that's what is very, very important, that if you are able to work from home, continue to work from home if your office allows that. And all of these things I think are very, very important to follow. And fourth, make sure that your hand hygiene and your surrounding hygiene is maintained. Wash your hands with soap and water or with the alcohol rub, and make sure that you have a clean surrounding for you. Also, watch out for the other seasonal diseases which are there, which can mimic like COVID. So we have seen a significant rise in patients with influenza A and B in Mumbai, and we know that this could be the flu season. So make sure that people who are vulnerable, people who are eligible, can get themselves a flu vaccine as well. While Dr. Joshi joins, I'm going to take a few questions from our viewers. Satyam Agarwal ji is asking, can I take Covaxin at 20 years of age? He has allergic rhinitis and there's a fear of side effects. I can assure you, Mr. Agarwal, allergic rhinitis and Covaxin will not have any interference with each other. Please go ahead and take the vaccine. It is absolutely safe in all individuals, and allergic rhinitis, as you already mentioned, is a case of an allergy which is usually to pollens or dust mite or something. It is not to a reaction from a vaccine. So please go ahead and take it. Mr. Kshitij Agarwal is asking, can vaccines negatively affect natural immunity of any person? So again, I think the way vaccines are produced and way vaccines are manufactured after extensive research, they are actually meant to improve your immune response towards a particular vaccine virus, not to hamper your natural immunity. With this, I welcome again Professor Shashank Joshi, a Padma Award winner, a brother to me, and he has been a light in the shining armor for the COVID-19 pandemic, and we all look up to him for his pearls of wisdom. Welcome, Professor Saab.
Thank you, Rahulji. Sorry, I got a little stuck in traffic bottlenecks. The way the Mumbai is, it is not a good sign.
It's a side effect of being in Mumbai.
That is true.
So we were taking a few questions from the audience. But before that, I would like you to give us a little update about why we are talking about the threshold of the third wave today. I have given my update on that, that the Kerala and Maharashtra and the slight increase in the cases which we are seeing across, as well as the test positivity rate. But your thoughts on that, sir?
So thank you, Rahulji. I think as we all know that there is clearly a peak which is happening in Kerala, and Kerala is accounting to the largest population of COVID cases, active cases as well as other cases, in the country. That if the country has around an X amount of active cases, and currently Indian number of active cases has dramatically dropped down. So that those number of active cases, if you see the total number of active cases across India, they are still sizable, 3,92,864. If you talk for today morning, and in that, if you see the number of active cases which are there in the state of Kerala, they are a very large proportion, and they are almost 2,39,000 cases are there. And then Maharashtra is number two at 51,000 cases. So, when we have 51,000 cases in Maharashtra, 2,39 cases, 1,000 cases from Kerala as active cases. I'm talking of active cases. I'm not talking of daily numbers, because daily numbers can be very erroneous. Then we have around 17,400 cases from Karnataka. And then, we have around, a sizable number of 11,414 from Mizoram, which is again, Tamil Nadu is 16,056, and West Bengal is 8,480, and Telangana is 5,505, and Odisha is 6,022. So if you see these numbers, and you are seeing some other trends here. Now, if you see the other trends which are happening, I'm not looking at Northeast. Where there is no COVID at all is Madhya Pradesh, 125 cases. So Jharkhand, 126 cases. Jammu Kashmir has gone up to 1286. Himachal Pradesh has gone up to 1699. Haryana has gone up to 617. Gujarat is 152. Delhi has started seeing a small spike of 367. So we are on the threshold of a third wave. The second wave probably has started declining in most of the country, except probably Kerala, Maharashtra, surrounding states of Kerala, and probably Northeast. But we are clearly seeing that there may be a reversal of trend, and that should be with the festive season of Ganesh festival, Onam just getting over, followed by, of course, we will have the Navratri, we will have Deepavali coming in, we will have Christmas going on. I'm in Bandra today. Now the Mount Very Fest, the September Fest has started here. So, and there will be, of course, Eid and other festivals. For all communities, there are festivals. Now there is fasting in the Jain community. The Parushan is on. So, in every community, some degree of festivities are there. And, people have got a false sense of security that they have taken 1 or 2 doses of the vaccine and they are protected. Rahul, you know rightfully that even if you have taken 2 doses of the vaccine, it will not prevent COVID. It will prevent severe COVID and death, may that also. We need to be cautious and careful. I think there is no scope for complacency against all variants and against all types, whether you are vaccinated or unvaccinated. Please wear N95 mask or a double mask if you don't have an N95 mask whenever you are in a vulnerable environment, which means whenever you are out of your house, whenever you're out of a bubble, whenever you're unmasking for eating food, when you are out of a bubble, it is mandatory to wear it. And if you get the earliest symptoms of COVID, immediately test. So I think there is some signal that the festive season may actually allow us to cross the threshold of the third wave. So right now, the crossing of threshold and timetable is purely in our hands, if you ask me. It is in the citizens' hands. And if we behave as responsible citizens, I think we can delay and defer the third wave. We can make it small and mutated, and it will ideally come somewhere in the month of November, December. But if we behave recklessly, if we overcrowd, if we go into poorly ventilated spaces, and we get that pseudo degree of confidence and do not mask in environments which are poorly ventilated, then it's a recipe for disaster. So my thinking is very simple, Rahulji, that we are seeing a small little spike. Let us not look at the tail of the second wave as a spike of continuation of the third wave. And therefore, we have to break the chain here. And in order to break the chain and make the second wave decline, it is very crucial and critical that we are able to do some aggressive public health measures. And I'm quite confident that we'll be able to get out of it.
Absolutely, absolutely.
So Rahulji, two
There are-
questions. One is Rashmi Karnawat has asked the question, Sir, how long we take care of our elderly parents? It has been over 6 months since they took their vaccinations. It is getting very, very difficult to live with restrictions. We really are at loss. It's a very practical question. And the other challenge is that the Delta waves swept throughout India. So that is another concern a lot of people have. Do you think that there will be another variant which may come in? This question was asked. I'll tell you the name of the gentleman who asked this question. Uh, uh, so, so is there any chance that there will be any other variant coming up for the next wave? So those are the two questions, Rahul.
Yeah, so I think both the questions are very, very important. Rashmi ji, I think your question is something which most of us are actually facing a difficult practical problem. Though our parents are vaccinated, we all want to protect them as much as we can, and we want to make sure that they are safe. Now, it is practically impossible to actually ask somebody to be locked down in the house and not step out of the house. So, my suggestion would be that you will have to be a little bit innovative. If your parents are fully vaccinated, ensure that they are double masked, and they could possibly go, if you live in an apartment system, they could possibly go onto a terrace or below your building into the garden, which or the space which you have, which is offered. Try to avoid crowded places. Try to avoid confrontation with other people within a few yards of each other. And I think they can safely take a round in the building. They can safely walk on the footpath if they have any place, or a small garden if you have near your house. I think that kind of a exercise will not only make them feel better, but would be also good for their overall well-being. Their movement, the fresh air, and all those things will actually help them to feel a little bit better, because all of us being locked down or bogged down by the entire scenario in which in this COVID pandemic, and elderly are no different. So I think you can easily do that. The second question which was asked is, if the COVID wave has already been swept by the Delta variant, where are we going to get the second wave, third wave from? Are we looking at a new variant? Unfortunately, Westfield 90 has asked this question. I don't know the name of the person, but unfortunately, Professor Saab, the reality is that virus is going to protect itself. It is meant to change its clothes, like its structure, like we change clothes every day. And while changing its structure, while making a copies of itself, it has one defective copy which gets made, and then that defective copy gets replicated, and then you may have another defect in that. And when that defect happens into a receptor binding site, you actually develop a copy of that virus, which becomes the virus which can either infect more, or can cause more harmful effects on the person, or both together. And if that happens, and vice versa is true as well, it may become less infectious and less lethal as well. But we are worried about the more lethal and more infectious one. And if that happens, it becomes a variant of interest or a variant of concern. And that is what is happening, unfortunately. When will this stop? When you have a sizable number of populations which has got some protection against the current strain of viruses, you will find that the virus does not have a new person to go and infect and replicate itself. And then this mutation process will significantly slow down. Currently, the world scientists and WHO, everybody knows that most viruses would mutate around 26 times. So it is 26 times the COVID-19 virus is mutating in the year. So that's around every 2 weeks it's changing its structure, roughly. And then we had this C.1.2, which was a variant from in South Africa, which actually was found to be mutating almost once every week, 48 to 50 mutations in a year. If you have that fast replication of a mutant variant, it will have a defective piece come out one day, which will be more infectious and more lethal. I think that's what we need to worry about. We need to worry about that kind of a thing. That's why vaccination is the most important thing which we can do. Sir, there are a couple of other questions. Mr. Pawan Gupta has asked a very important question. Can we doctors who are vaccinated sit together without mask in meetings and kitties? So I believe kitties in the sense you're asking about parties. So that's one from Dr. Pawan Gupta. And the other one again has been asked by Westfield 90, who says that is there anything which is used can be used prophylactically to avoid third wave? And he has not mentioned masks or vaccine in that. So he's mentioned all the other drugs in that.
So let me take the second question first, Rahulji. To prophylactically, there is only vaccine and mask. Whatever you have mentioned, hydroxychloroquine, ivermectin, monoclonals are not for prophylaxis. If there is pre-exposure or post-exposure prophylaxis into a high-risk situation, these are recommended, in which, of course, monoclonal antibodies have data. Ivermectin does not have that robust data. Hydroxychloroquine has some data. So in absence of data, to recommend any of these three is inappropriate. Double masking is most appropriate, followed by vaccination. So that is as far as the second question is concerned. Pawanji, if we are sitting together in a meeting without two vaccinations, you need to understand where the each person and each individual is sitting with you. What is the risk of that person's exposure to getting a viral entry? So unless and until one is certain that you have tested each person in your kitty with a RT-PCR test and they are all negative for the last 2 days, and then you are into an air bubble, you are safe. Otherwise, you are as vulnerable as others if you are unmasked. So remember, there is no such immunity. Yes, you might get asymptomatic or mild infection, but you are vulnerable. You can't say that you are not vulnerable. In fact, most of the healthcare workers' transmission has occurred after their COVID duties are over, when they sit in the canteen or start to have a cup of tea. When you go for a walk, you are well masked. And when you sit down to have a cup of tea or a glass of water or some snacks, that's the time you unmask, and that's the time the transmission occurs. And for Delta virus, all it needs is 5 or 10 minutes of interaction time and a distance of less than 2 feet. And there you have it. It's fast spreading as chicken pox. So I think one has to be cautious and careful. But if you are very sure of your air bubble, if you are very sure of the people who are with you, you are reasonably certain about their exposure likelihood, you will have to take your own calculated chance and risk. But that there will always be a risk. So you cannot have a risk-free zone. It's like padam padam vipadam. When you cross the road, there will always be an obstacle. So while crossing the road, you need to understand that you could have an accident. Chances are 0.1%. Now, does it mean that I don't cross the road? No. I can still cross the road, provided I take precautions. I see on the right, I see on the left. I ensure that I take adequate safety. I walk on a proper, you know, uh, zone which is allowed for peddlers to cross the road. And if there is a signal, I observe the signal. So when we are crossing the road and when we are taking due precautions and due diligence, similarly, when we are sitting with people who may be potential spreaders or super spreaders, you need to take some degree of precautions unless you are reasonably certain beyond doubt. So that's something which we need to understand. Okay. Also remember, after two vaccines, breakthrough vaccine can still occur, breakthrough infection. So it's not getting you a immunity, but yes, your likelihood of transmission is lower. So you will have to take some degree of risks and some degree of caution and care. So Rahulji, two questions for you. One is from Rufina Wilson. Sir, my daughter is going to visit me in December and she has taken two vaccinations. How safe is it for her to come to India? That's a lot of people asking this question every day. Because now everybody is making their plans for December and they think that there will not be any problem at all. And the other challenge is that which writer poet Neeraj Tyagi is asking, why is there no antiviral drug for COVID even today, despite of all the advances?
So, sir, I'm actually going to take one comment from Shubham Sen. Doctors are now marketing agents. Shubhamji, I can understand that we are all in a very difficult situation, but trust me, no doctor is a marketing agent. 1500 plus doctors have lost their lives. Several nurses have lost their lives. Several healthcare workers have lost their lives trying to protect, trying to do their work, trying to do their normal job. And I think we need to just respect everyone right now. I'm sure, right from the person who is helping us to maintain our environment clean to the leader of the country, our honorable prime minister, everyone only has one thing in mind: how to make each other safe. So let's make each other safe, let's keep each other safe. I think that's what we should be doing. Coming to the question of Rufina ji, I think that's a very difficult question to answer, because there is no correct answer for it. The correct answer for it is that when your daughter comes in, whatever rules of India would be in prevalence at that time. For example, right now, if anybody is arriving at Mumbai International Airport from abroad, has to do a RT-PCR testing, and only then they will be allowed to go home, or allowed to basically come out of the airport. I think that kind of a precaution will have to be taken. It would be prudent that all of you, because your daughter would have traveled from in a plane, it would be prudent to keep her, as masked as possible during the flight. But it might be difficult on a long flight not to remove the mask at all. I understand that, and you need to also understand that the risk cannot be 0% for anybody who's traveling. There will always be risk. Approximate risk cannot be put into any figures. The second question which is there is about antiviral drugs for corona. Now, unfortunately, Writer ji, Neeraj Tyagi ji, if you look at the viruses which are known to mankind, there have been only maybe 5 drugs in the whole history of antivirals which have proved to be effective. The one which we know for sure works very well is acyclovir against herpes virus. We also know oseltamivir works against COVID, against once again H1N1 if given early. There is some evidence for the other antiviral drugs like remdesivir and molnupiravir and favipiravir. But viruses, by the virtue of their structure being a RNA or RNA virus or a single cell virus, they actually are very, very difficult to control. And that's why most antiviral drugs do not actually act on that. And that becomes a big problem. And hence, I think any antiviral drug to be produced or brought into the market is extremely difficult, especially for those viruses which are fast mutating viruses or which are fast infective viruses. So last couple of questions, sir. One question again from Dr. Pawandeep Gupta is about booster dose. I think he's asking that we as professionals are exposed to virus. Is it better to get a booster dose? And a YouTube user is asking about surface transmission. Where do we stand today about surface transmission?
So surface transmission, let me be very clear, is very mitigated, but we cannot ignore it. So because we don't have adequate data published now in the current literature to show fomite transmission exists, it is not totally dismissive, but probably its likelihood of its transmission is quite low. What was the first question, Rahulji?
The first question was booster dose, sir.
So booster dose for immunocompromised individuals who have not generated antibodies may be a possibility in the near future, which may be there. But this will have to be going through our NTAG. And our NTAG currently is on a public health mission, which is to vaccinate most of the people most of the times. So right now, no exceptions will be made. But for immunocompromised individuals, clearly there may be a role for additionally having an additional dose of a COVID vaccine. In absence of, if you are immunocompetent and if you have taken 2 vaccines, there is a reasonable chance that you will not die and there's a reasonable chance that you will not get critical disease. There could always be an immune escape, there could always be a variant of exception and a variant of concern and a variant of interest, but that is something at a public health level, the government policies are there. Currently, remember, less than 10% of the world is vaccinated. So vaccine equity comes in the picture here. And which is why booster is not something which is being thought of. In United States also, the Center for Disease Control has clearly spelled out the criteria. People who are moderately or severely immunocompromised, they are looking at giving a additional dose. In addition to that, anything else is an exception. You have to talk to your healthcare provider and he will talk to the necessary authorities, and from time to time these guidelines will change. So we might get a booster guidance maybe in 3 months from now. Currently, we are very proud of India. We are hitting a crore mark almost every third, fourth day. So our vaccination program is at full blast. We congratulate Government of India for an outstanding vaccination program. I think this is a world leader now. We are in vaccines, and I think in vaccination also. So if we are able to complete our milestones of vaccination quick and fast, probably next year early, you might have a discussion around a boosting for competent people. Right now, if at all it comes, the boosting guideline will come only for immunocompromised people, and right now it is not there. So, Rahulji, Meena Shrikant is asking a question. Can we expect some normalcy by April 2022? And Parth Patel is asking a very simple question. Why can't Kerala control their crisis now?
Okay. So the first question is, when do we expect normalcy? Again, it's a crystal ball question. But if let's look at some scientific understanding of this normalcy. So what is normalcy? Are we going to see COVID completely disappear? Even I would love to see that. But more likely than not, COVID would become endemic in our country, is what most epidemiologists feel. And I would like to believe the epidemiologists more right now. We all, trust me, we all would be very happy if COVID just disappears, like the SARS virus just disappeared one fine day. If COVID just disappears, it will be really good, but it looks unlikely. So a normalcy can be assumed when majority of the population in the country and preferably in the world is vaccinated. So I believe that would take much more than April 2022 to get vaccinated. But I believe that towards the mid or the end of second half of the next year, which would be few months after April 2022, maybe August, September, by this time next year, you would possibly see that the COVID is not disrupting your day-to-day life. You will still probably need to continue wearing a mask, but you will be able to probably function normally. You'll be able to travel normally. You may have some restrictions like vaccination certificates and stuff to be shown from port of entry and exit and all those stuff. But I think much of the normalcy can be achieved if vaccination program goes up very, very smoothly and is able to vaccinate much of the population. The second question by Parth Patel, which I think would be the last question, which I would take, and then I will have your final words, sir. Parthji, Kerala is actually doing very, very well to control the cases right now. If you see, the cases have come down from 30,000 to around 19,000 yesterday. And when we talk about controlling the cases, there are two or three aspects of that, which are the epidemiological principles. The first is that you test as many as you can, which they are doing. The second is, as soon as you test, you actually isolate those people, you ring fence those areas, you ring fence those people in such a way that they do not actually come into contact with others. Third thing is, you contact trace the people who had come in contact with them as quickly as possible within first 24 hours, isolate them and test them. And the fourth is to treat all of these people who are vaccinated, who are positive, so that we decrease the mortality in those positive patients. And the fifth thing, which Kerala has been doing quite well, is they have been having high numbers in vaccination. I think that is what is sort of helping Kerala to bring the numbers down. If we follow there is no magic bullet here, there is no magic wand here. You have to go back to the basics of drawing board and understand that to try and decrease the numbers, you will have to follow these immunological principles. So with this, Professor Saab, if you can give your final comments for the evening for our viewers, and that would be the pearls of wisdom, which I always love to hear from you.
So Rahulji, thank you so much. I think Rahulji, you are very right. We are at the threshold of the third wave. It is in our hands to delay, defer, and make it small. We still need to vaccinate. We still need to mask. We still need to be cautious and careful, and we need to still be alert on the prompt at the earliest symptom to test. I think COVID is here to stay. Though COVID is still not endemic, we are still in the pandemic times. And I'm reasonably certain that India's vaccination rate is one of the best on planet Earth. We are also taking due diligence and care, except for some geographies of India because it's as good as a big continent. Overall, we are out of the second wave. Let us hope and pray that those geographies which are not out of the second wave come out of the second wave. Let us behave responsibly, particularly during festive times. Let us celebrate our festivals at home. Let us celebrate them in an air bubble. Let us celebrate them with caution and care. And let us wait for a brighter and a better tomorrow. My heart goes out to all the people who have lost their lives due to COVID. And we really salute our Dr. K.K. Agarwal, beloved Dr. K.K. Agarwal, for whom we are dedicating this show every time, time after time. We will soon join you again. And you know that there is a Dr. K.K. Med Talk every day, day after day, ensuring that you do capacity building in education. So let us meet once again for another Dr. K.K.'s Med Talk tomorrow. Thank you and Jai Hind.